Hello, and welcome to the Dystonia Advocacy Network's review of the Dystonia Advocacy Program. My name is Janet Heischetter, and I provide staff support to the Dystonia Advocacy Network, and I also serve as the Executive Director for the Dystonia Medical Research Foundation. It's my pleasure to welcome you to this recording. I'm also joined today by Carol Rawson, who is the chair of the Dystonia Advocacy Network. Carol also serves as the Vice President for the DMRF's Public Policy Committee, and by Philip Goglis, who is Vice President with Health and Medicine Council, a team that has provided guidance and support for our dystonia advocacy efforts for the last probably 25 years, right, Phil? Not you, but the team itself. So we're in good hands with the Health and Medicine Council. So thank you both for joining us today and for helping us to provide an overview of dystonia advocacy efforts. So, Carol, what is the Dystonia Advocacy Network?
Thank you for asking, Janet. Good morning to everybody. The Dystonia Advocacy Network, or the DAN, is a coalition of 4 dystonia patient groups working collaboratively to address the legislative and policy needs of the dystonia community. It's comprised of the Benign Essential Blepharospasm Research Foundation, the Dystonia Medical Research Foundation, the National Spasmodic Torticollis Association, and the National Spasmodic Dysphonia Association, which have worked together for over 15 years to increase awareness of dystonia with members of Congress and their staffs, and make sure the needs of the dystonia community are addressed.
That's great. Over 15 years of collaboration. That's really wonderful. How does the DAN work?
Well, every organization comprising the DAN has a representative on the DAN steering committee. The steering committee meets with Phil and the team at the Health and Medicine Council annually to develop an agenda for the year. DAN advocates are all sent informational packets that contain an overview of the issues and sample speaking points and templates for written communications to members of Congress. What is most important for all advocates to know is that their stories are so very important in helping congressional representatives understand what dystonia is and how it affects their lives. To help all advocates understand the issues and what we are asking from Congress, we will schedule webinars to provide a briefing on the issues that we are asking advocates to contact their members about. The webinars give an opportunity for advocates to ask questions. All of these webinars are recorded to view again if people want to, or to view if someone has to miss the webinar. Historically, we do this once a year with visits to offices, but recently, because of COVID, we have been emailing, writing letters with key members of Congress, and participating in virtual meetings. DAN advocates also respond to what we call action alerts throughout the year if needed on key topics. These alerts will be sent via email with instructions on what to ask and how advocates should proceed.
Great. So once somebody signs up, we make it as easy as possible to keep them in the know and to help them with what they would need to do. Yeah, it's great. Great. Phil, I know we should know this, but would you just review for us sort of how Congress is organized?
Sure. And I just want to say a quick hello to everybody who is joining us. It's a pleasure to be with you again. I've had the opportunity to meet many of you and look forward to meeting those who I haven't met in the future when we're back here in person in Washington, D.C. So just quickly how Congress is organized. You have 2 separate sides of Congress. You first have the House of Representatives, which has 435 members. Each member is elected from a specific district, and how those seats are comprised is based off of population. So you have high population states like California, where Carol is, that have over 50 members of the House, and then you have low population states such as Delaware, which only has 1 member of the House. Every 10 years, the composition changes, and we're currently going through that because of the census, where some states may gain seats and some states may lose seats. You know, for example, California is losing, I believe, 1 or 2 seats in this redistricting process, and Montana, who previously only had 1 seat in the House, is now going to have 2 seats. So because of population shifts, they're adding another seat. So the House of Representatives always has 435 members, but the number from each state changes every 10 years depending on population. On the Senate side, though, however, you have 100 members, which is 2 from each state, and it doesn't matter if you're from a high population state like California or Florida or Texas, or a low population state like Delaware or Rhode Island. You only have 2 senators. So the Senate doesn't matter the size of the population of the state as it does in the House. And the House is elected every 2 years. So every 2 years, you have the whole House of Representatives that are up for election. But on the Senate side, you only have a third of the Senate every 2 years who are up because they're elected to 6-year terms. So it's a little more stagnated that way. And you have a difference in just the general work that the Senate does because they're there for a longer period of time of 6 years versus every 2 years.
Yeah, so you touched on this a little bit, but what are the differences between in responsibilities between the Senate and the House?
So the House has always been referred to as the People's House, and because they are elected to 2-year terms and they represent individual specific districts, they're traditionally have been known as the People's House, where they have the closest contact with members of the public because of the work that they do. Just a quick breakdown of some of the committees on the House and Senate side and why that matters. On the House side, you have the Appropriations Committee, and they are the ones who decide how much funding is allocated for each federal agency and federal program every year. The Senate also has an Appropriations Committee. You have also the Energy and Commerce Committee and the Ways and Means Committee, which handle healthcare related items and issues with CMS and insurance on the House side. On the Senate side, you have the Health, Education, Labor, and Pensions Committee, which is appropriately the HELP Committee, and they provide the same oversight and regulation as the Energy and Commerce Committee. Then you have the Finance Committee on the Senate side, who does the same work that the Ways and Means Committee does. One of the big differences between the House and the Senate is the House is where bills originate in terms of the appropriations front, and we see how through the process the House often will share their recommendations and release their bills, and then the Senate will release theirs, and then they work together to conference those for final bills where they decide what the final funding level is going to be, what final recommendations they're going to be. The House will often pass bills first, and then it will go over to the Senate. The Senate has been called the greatest deliberative body, as they are the ones who take a little more time with legislation. They're the ones who try to work the process through a little more regular order in terms of the committee process. The House is again, because it's the People's House, they are very quick to respond to the needs of their constituents. And if we really want to go back to, 5th grade social studies, the Senate was designed to be a cooling off area where the House responded to issues that were brought to them by their constituents, and they would quickly draft legislation or policy changes to address those, and the Senate, would receive those and be a little more deliberative in trying to figure out, what the best way to solve those issues are. But they do work very closely together on advancing key priorities, and we do a lot of good work with both sides in the House and the Senate to advance our specific priorities.
Yeah, thank you for that. Seasoned advocates will remember that we often target or focus on certain members of Congress. Would you just explain why we do that?
Sure. So all members of Congress are important because they all have the ability to weigh in on legislation and to advance critical priorities. But as I mentioned, the 6 committees, 3 on the House side, 3 on the Senate side, those are the committees that have direct jurisdiction over our key priorities. So appropriations, how much money is being spent, and then the Energy and Commerce, Health, Ways and Means, and Finance, with regards to access issues or to other oversight of federal agencies that we engage with. So we focus on these target districts and these target states because those are the ones who have a direct role in the policy that's created and a direct role in advancing some of our priorities. If you look at folks on the Appropriations Committee, they're the ones who write the bills. They're the ones who decide how much money is spent for NIH or for other programs or federal agencies. Somebody who's not on the Appropriations Committee does have the ability to influence that process, but working with somebody who's on the committee gives us a direct line and a direct way to engage on those issues. You also, on the other committees that we have discussed, members who are on those committees are able to shepherd and see through pieces of legislation or specific priorities, and they have that oversight of the federal agencies that we engage with. So they're able to send a letter or to hold a hearing to investigate, to get answers from federal agencies or programs about the status of what we've asked them to do, or the ability to weigh in on what it is that they're doing. So while all members of Congress are important because they all vote on bills that have to do with us advancing key items, we really focus on those target members because of their leadership on those committees and their ability to directly influence the legislative process.
No, thank you for that. So why is it important for those members of Congress, or all members of Congress, to hear from patient advocates? Why can't you just go in there and say, this is what the dystonia community needs?
And that's a good question. You know, I work here in Washington, D.C. Every day to advance our priorities. And, you know, there are 100 members of the Senate and 435 members of the House. So 535 congressional offices in total. And I can go into each and every one of them and talk about the importance of NIH funding, the importance of the Department of Defense, the importance of patient access issues for the dystonia community. The one question that everybody will ask me is, how does this affect my state? Or how does this affect my district? And who's affected by this? And they want to hear from you, being their constituents. So by advocating, you're part of a nationwide grassroots network where we're able to expand our reach and our engagement with members from across the country, engaging with folks from California or Florida. You know, the committee rosters are comprised of people from all across the country. Mm-hmm. So having a large grassroots network from across the country, of course, the more people who are asking for something, the greater the likelihood that it is included. So we work very much across the board, you know, to ensure that we have a large number of folks who are engaged in developing those relationships, in speaking with members of Congress. You know, we are talking about funding levels that are in the billions of dollars. We're talking about sometimes complex access issues or different policy proposals. And it's important for members and their staffs to see the human side of all that, that we're not just talking about dollars and cents, but the difference that funding for key programs, what difference that makes to their constituents, and to be able to put a face and a name to the work that they're doing. You know, we have seen time and time again how we have developed key relationships with offices because of the connection with a constituent. And I will check in with them and ask them about, you know, a certain item, and, you know, they want to make sure that the constituent of theirs is the one who receives the follow-up. You know, as a quick example, two of our big champions on the House side are Congresswoman Jan Schakowsky and Congressman Chris Smith from New Jersey. One's a Democrat, one's a Republican, but are both, you know, strong champions for us. And the reason why they are champions are because of advocates who cultivated and developed those relationships with those staffers and with that office. And we know that that's really what makes the difference about having an advocate who is a constituent, who's able to check in, who's able to remind them about the local importance of their support. So you guys are the true rock stars and the true VIPs in terms of using your voice to educate members and to drive home the importance of supporting our priorities.
Yeah, and I will, Carol, you touched on this a little bit, and I just want to thank everybody in advance, all of our advocates, for their willingness to share their stories. But Carol, you've been a long time advocate. I mean, how is it from your perspective when you're advocating in those offices to those members of Congress?
Well, as an advocate, it gives you a sense of empowerment. Mm-hmm. And the people there can have an idea of what you're living through our stories. And instead of feeling like a victim, as an advocate, we get a sense of purpose through our advocacy. And we can help change the course of the futures of those of ourselves and those we love. And we need all of your help in raising our voices through sharing our stories and advocating for greater funding and visibility for all of us who are suffering with this debilitating disorder.
Yeah, no, thank you for that. Yeah. And I think we have a demonstrated track record that dystonia advocacy works, right? Our advocates are really powerful. And as Phil said, we've developed champions on the Hill. And I mean, you know what a difference it's made. So thank you, everybody, for your willingness to share your stories, because as Carol said, it is those stories that are remembered by representatives. So Phil, can you talk a little bit, you talked a little bit about the funding at NIH. Can you just talk a little bit about the relationship between NIH and Congress?
Sure. So NIH is the National Institutes of Health. That is the premier research entity that we have in our country. And I'm sure that over the past 2 years, folks who may not have been familiar with NIH or the CDC, for example, have gotten a crash course on the work that NIH does and CDC does. But we work with the National Institutes of Health to ensure that research is being done into all forms of dystonia. And it's important that we engage with Congress because they're the ones who decide how much funding the National Institutes of Health receives. And why that's important is because the more money NIH has, the more money the institutes have, the more money they're able to put into research. So Congress fully supports the National Institutes of Health in terms of not only funding, but also recommendations about, some research that Congress would like to see them engage on, or Congress will ask questions about specific areas of interest that they would like to get some more information from NIH on. And as part of the annual appropriations process, there are pieces of what we call report language that are different recommendations or questions that Congress has for NIH, and the NIH is required to respond to Congress within a year about what's going on and answer those questions. So in our space, we've been very successful at having recommendations included where Congress asks NIH for updates on dystonia research, on different things that are going on, and NIH has to respond to that and say, okay, this is what we're doing in terms of this dystonia research. We have this event coming up, or these are the things that we're working on. So it's a good opportunity for Congress, as part of their oversight with NIH, to see what's happening, what progress has been made. If there needs to be, a gentle nudge to focus on some other things, they're able to do that. And that's why we focus our engagement on Congress, because they're the ones with that specific oversight where they provide the funds, but they're also able to follow up, whether it be a letter from members of Congress, about what the status is of things. And we've done this before in our community where we've worked with federal agencies, NIH specifically, where we're trying to advance, a state of the science meeting or to get some more information. We'll have a member of Congress who's one of our champions send a letter over to the NIH, with a very direct question of what is the status of dystonia research, what is going on, what are some concrete next steps, and the NIH knows that they have to respond to that. So it's critically important that we continue to serve as that very critical in between Congress and NIH to also support the good work that NIH does, because NIH does a lot of great work and supports a lot of good activity. So we want to make sure that NIH has everything that they need, but we also want to make sure that Congress is fulfilling that oversight role and making sure that if there's something that we need more information on or we would like to see more of, that they support us with that.
Right, that makes sense. Thanks for that. And we, as advocates, sort of serve as that squeaky wheel, right, to sort of nudge Congress to put a little pressure onto NIH. So how is NIH organized? I mean, is that relevant to us, how they're organized?
Yep. So NIH is a very large campus up in Bethesda, which is just north of Washington here. And it is broken down and organized into 27 institutes and 6 centers. So there is a lot of research that's being done there. We focus on some specific institutes, such as the National Institute of Neurological Disorders and Stroke, which is NINDS, the National Eye Institute, which is NEI, the National Institute on Deafness and Other Communication Disorders, which is NIDCD, and NCATS, which is the National Center for Advancing Translational Sciences.
Alphabet soup.
Yep, you can tell it's all a mouthful, and that's why we live with acronyms here with everything. So those different institutes and NCATS being a center, they focus on primary research for dystonia. The NINDS does a lot of work on dystonia in general, and then you have NEI, which does work on blepharospasms and different eye issues, and then NIDCD researches spasmodic dysphonia and other communication disorders. So we work with all of those relevant institutes to ensure that they are not only performing critical research into those specific forms of dystonia, but also collaborating with the other institutes to ensure that we are working on a full spectrum of research activity, and that we're communicating what's being found as part of different studies and how we can ensure that there is good quality research coming out of all of them. NCATS is important because what they do is they focus on transforming those scientific discoveries that are funded through the research and are found into new treatments and cures that can be delivered faster to patients. So, looking at what has NINDS done, okay, we have a breakthrough in dystonia. How can we translate that to make sure that it makes a difference in patients' lives, sooner, not in a long-term sense? Or we have a new piece that was researched at NIDCD, and how does that affect the spasmodic dysphonia community, and how can we go ahead and look to improve patients with that because of this new discovery, and let's get that into a treatment or different areas. So there's a lot of good work that NIH does, and we're very focused and targeted to those who have direct day-to-day work with dystonia.
Yeah, thank you. And thank you for your oversight and monitoring of all of that's taking place on that campus. I think it reflects the challenge that we all feel, given, that dystonia is a very complex disorder that affects different people differently. So thank you for your work there.
And I will plug that we are very much involved in. Janet did serve as a member of the advisory council for NINDS for a few years. And that's critically important because she had a front seat at the table to elevate the importance of dystonia research. And it's because of those relationships that were made that, we're able to continue our work with NINDS and with NIH. So we consider ourselves a great partner with NIH. There's a lot of good work that they do. And we have a very effective working relationship with them. And that goes back many years.
Yeah, well, and thank you for that. And thank you. NSDA and the EBRF have also had really strong relationships with respective institutes. So I think as a community, even though we're small, we've been very strategic and, knock on wood, pretty effective. So just changing gears a little bit, Phil, can you talk a little bit about the best way to communicate with our elected officials? I mean, we're still obviously operating virtually, and Congress, it's difficult to have meetings on the Hill for COVID and security reasons. So what's the best way for us to communicate with them?
Sure, there are many different ways to communicate with your elected officials, and of course we always encourage you to utilize what you're most comfortable with. You can communicate via email with your local officials or their staff here in Washington, D.C. You can use the snail mail, old school, write a letter and mail it into your local office or to the offices here in DC. You could call the office and talk to a staffer, and you can engage in virtual meetings. And, we have, for those of you who have been to DC in the past, we've had very active days of full meetings on the Hill where you're meeting with staff and sometimes members. So we are hoping to get back to those in-person meetings as the country slowly reopens, and here in DC, Congress reopens, and we get back to somewhat of a normal advocacy engagement where we're able to bring folks onto the Hill and have those in-person meetings. But any communication you have with a member, all of it is important, and all of it does make a difference. I know some people may ask, well, I just sent an email, does it really make a difference? The answer is absolutely 100% yes. Anytime you engage with a member of Congress, however the platform, all of that does count, and all of that is critically important and does make a difference. So we always encourage folks to do what is most comfortable for them. I know that some people would like to send an email because they don't like to public speak or things like that. So they would rather send an email. Some people like to talk on a phone and feel like they had that, personal connection one-on-one with hearing from the other person. It's really what you're most comfortable with. And we have all of these different tools to help you with whatever way you want to engage with Congress. So don't hesitate to reach out and let us know. But we are also working on the importance, or continuing to work on, the importance of developing and establishing relationships with district staff. Again, going back to our champions, they were created because of local outreach and because of the development of that relationship with their constituents. So there are different ways to contact, and I encourage you to join our webinar where we talk about contacting Congress and going through those steps. But the best way to communicate is to engage with them, on the local level here in DC. We are in a year now where there is going to be a lot of activity because it is an election year. So you will see folks out and about at fairs or different community events. And I always encourage folks to take the opportunity to say hello to an elected official who's there. And if you have a minute or two with them, to just briefly touch upon the importance of dystonia with them, let them know who you are, and ask for a staffer's name so you can follow up with them and to develop that relationship. But can't stress enough that you don't have to be an expert in any of the policy components to engage or to communicate with your elected official. The most important thing you could do is just share your story and make that connection. That's what Janet, Carol, and myself do. We work on the policy side, and I'm very much into, on a daily basis, the technical aspects of everything and the policy. The most important thing that you can do is just to be yourself and to connect with them and share your story, and then let us know about it, so that way we can follow up with members and their staff about your interaction.
Yeah, no, thank you for that. I mean, we've had some very creative communications over the years. We have advocates who have stopped members of Congress on planes to just thank them for their support and to introduce themselves. So yeah, as you said, seize every opportunity. We are going to send out information for this, our advocacy efforts later this month. So everybody will get that. And to Phil's point earlier, there are sample talking points and sample email. And one of the recommendations that Carol has made over the years is that we all have the same topic if we're emailing, so that our messaging is really clear. So thank you, Carol, for that. And so that'll all be coming out. And then we'll do a review of all of the issues that we'll be advocating for later this month on March 15th during our webinar. And that webinar will also be recorded for future use. So Carol, can you talk a little bit about how we keep our DAN advocates in the loop on news?
Well, we send email updates on issues that are important. We send action alerts if there's something that needs immediate attention. It's really important that we get as many people to send emails or make phone calls to their representatives so that we could get whatever important issue it is through Congress, through the Senate. And again, it's our stories that make all the difference and these connections. So we need all of you. And we know it's been difficult since COVID and that we're not actively on the Hill engaging, but please bear with us. Hopefully by next year, we'll be back on the Hill and we could see everybody face to face and meet with our representatives. And just know that we need you, we need your support, and it's through our stories and our engagement and advocacy that we could really make a difference to the dystonia community.
Yeah, thank you.
Thank you. Thank you all for your efforts and for your engagement. It's much appreciated.
Yeah, absolutely. And thank both of you for sharing this information with us today. I think it serves as a nice backdrop to what we're going to be doing this year. We're very excited about this year. We have a record number of new advocates. So we're really ready to get out there and get moving. So we look forward to seeing everybody on March 15th with that webinar. And again, thank you, Phil and Carol, for the information you shared today and for your leadership in this very important area. So thank you, everybody.
Thank you, Janet.
Thank you.
Thank you, Phil.